Hi, I'm Dr. Christopher Storey. I'm one of the new neurosurgeons providing neurosurgical services here at Sumner Regional, along with Dr. Jay Ohm and Dr. Conley. So we brought a neurosurgical service line, and we now have a neurosurgical ICU to care for these patients. Along with this, so we're providing cranial and spine services. So we're handling everything from head bleeds to intracranial tumors to spine fractures, degenerative disease, spinal tumors. All these services are now available at Sumner Regional, so patients who have weakness due to any of these or confusion, we can now take care of these and provide these services at Sumner Regional, and they had the same level of care they would get from going into Nashville, because we are all still the physicians that cover at Centennial, Skyline, Summit Hospital, Southern Hills, the same group of practitioners that they typically would get transferred into town to be seen at. Although Sumner Regional is an accredited stroke center, we currently do not offer thrombectomy there, but hemorrhagic stroke we can treat there. But if there's anything that cannot be treated at Sumner that requires thrombectomy or aneurysm treatment, we can transfer that to our hospitals where we can treat that, and they still get the same level of care at those facilities. So to give some examples of some of the cases I've personally treated here, we've had several subdural hematomas that came in with either worsening speech, it's more common when a left-sided subdural, or worsening weakness on the contralateral side. And basically those, depending on the acuteness of the bleed, typically your more elderly patients typically have the chronic bleeds, and more acute trauma, younger patients have the more acute style bleeds. So the acute bleed, usually because the clot is thicker, requires a larger craniotomy, which is the window of bone we make to remove a piece of skull to really be able to take out that blood clot that's on over the surface of the brain. It's not within the brain when it's a subdural hematoma, as opposed to chronic is more like a Motorol type fluid, where we're able to do a smaller craniotomy or sometimes just a burr hole through the skull and place a drain to allow to pull that fluid off the brain to decompress it and resolve their symptoms. Also, we've had patients with tumors in and around the spine that have either caused fractures that required correction of the malalignment and decompression of their spinal cord, which we've seen significant improvement in those patients' function. We can do all that complex instrumentation here to allow for the patients to have their maximum recovery and go on to get their radiation chemotherapy to treat their primary cause of the disease. So Sumner Regional, along with our group, Nashville Neurosurgery Associates, provide 24/7 coverage for all neurosurgical emergencies here at Sumner now, and plan to continue to add our capabilities out here over time to eventually provide stroke coverage as well.